UK Prime Minister Boris Johnson has been admitted to hospital over persistent symptoms, including a high temperature. This is 10 days after testing positive for COVID-19. I'm joined by our UK correspondent, Olly Baratt, to chat about this. Olly, when he was last seen in public, he wasn't looking well at all, was he? What is the status of his illness now?
No, the last we saw Boris Johnson was a video that he recorded on Friday. At that point, he was telling the country that he was having to remain in self-isolation because he was continuing to experience some symptoms of COVID-19, despite the fact it was a week on since his positive test. So he would have expected at that point to have started to feel somewhat better, but now Downing Street is saying that he has been admitted to hospital as a precaution because of the fact that he has these persistent symptoms of coronavirus, including a continuing high temperature. So Downing Street saying that he'll be having tests in hospital, routine tests, they are describing them as. We are told also by Downing Street that this was not an emergency admission to hospital, that he did not require an ambulance to be taken there, but that he was taken to hospital on the advice of his doctor as a result of these symptoms continuing. So we will await the results of those tests and wait to hear from Downing Street as to exactly what doctors believe about his status, about his current symptoms and about his health levels. But you're quite right, we haven't seen him since Friday, and at that point he didn't look particularly well.
I should imagine very disturbing for people living there. I mean, the number of deaths just keeps soaring. I guess the Queen's speech came at a pretty good time then.
Yeah, interesting timing that, of course, to hear from the head of state in a very rare address like that. Only the 5th time she's addressed the nation outside of Christmas speeches since her multi-decade reign began. So that in itself gives you some sense of the gravity of the situation that we're in, viewed by Buckingham Palace and the government. And the government will have known all through this crisis that that was something it had up its sleeve, if you like, a national address from the Queen. It was filmed at Windsor Castle, and the fact that the timing of this is now gives you some sense that the government and Buckingham Palace believe that we are heading into a crucial few days. A message of gravity, as I say, from the Queen, but also one of thanks, thanking National Health Service and other frontline workers, making very clear the seriousness of the situation that the UK finds itself in, but also a note of optimism, insisting that the UK will succeed, will get through this. And very deliberately, there were several notes in the Queen's address which, you know, harked back to wartime and her experience of that as well. Quite right that this is probably something that for large parts of the population they were needing to hear from the Queen, and many people judged her address as tone perfect, note perfect, if you like. This is a woman, of course, who has a huge amount of experience of situations that many of us have not experienced, and the Queen trying to reassure the country at a time in which, as I say, we're definitely heading into a very difficult few days in the UK, given that number of deaths that we're seeing on a daily basis now.
Yes, tell us more about that. I mean, how the health services are dealing with the COVID-19 and the status of the lockdown.
Well, in one sense there is good news, which is that the UK medical officials continue to say daily that despite the rising number of deaths, the rising number of hospital admissions as well, that as of right now the National Health Service is not over capacity. There is capacity still left in the system in terms of intensive care beds. All of that said, there are some isolated incidents up and down the country in healthcare situations in which healthcare professionals are saying they haven't got quite yet the right amount and quality of personal protective equipment. The government insists that's an issue of distribution rather than of supply in general. But clearly, if those numbers of deaths do continue to rise, as we expect they will, then the healthcare system is going to be ever more strained. Of course, one of the things that the country is watching is that total number of deaths and that trajectory of the curve? Is the UK going to continue to follow countries like Italy and Spain, or are we at some point in the not too distant future going to hit some kind of plateau, some kind of peak to the outbreak?
All right, Olly, let's leave it there. Thank you for that.